So it's great news about the vaccine. We've always had a smallpox vaccine that we could use to protect against Mpox, but now we have the Bavarian Nordic Mpox vaccine, and this is really exciting news. This is a vaccine which has got slightly wider usage, and it means that we can start using this vaccine in adults in affected areas. Hopefully, by the end of the month, we can start using it in the 12 to 17-year-old age group.
Is this vaccine new? I understand it has been, or a version of it has been used against a different strain of Mpox since 2022. What more can you tell us about the vaccine?
This vaccine is it's based on similar technology to the original smallpox vaccine. It is slightly more attenuated, and I won't go into the technical detail, but what that means is that we can use it on a wider group of people. It's well studied. We know it protects against Mpox, and we have the ability to produce more of this vaccine more quickly. So it's good news indeed.
How significant is this development? How effective do you think it will be against the current spread of Mpox?
Very effective. So Mpox, as most of the viewers might know, is transmitted by close physical contact, including sexual contact. And so one of the easy ways in which we can prevent Mpox transmission is obviously separating people, distancing people, but by vaccinating groups that are living close together in highly affected areas. So this vaccine is going to be really important in stopping that transmission in these high-risk communities. It's very effective. We know how it works, and we should start to see an impact within the next few weeks and months.
Are there other similar vaccines available that have been in use, or this is really a first?
This is one of the first ones that's been rolled out. As I say, there's been a vaccine that's been around for a very long time, the original Mpox vaccine. So a lot of people over the age of 40 were vaccinated against smallpox, and it also happens to protect against Mpox. But this is one of the newer ones that's out there, and I imagine there will be more to follow. So all very good news, very promising. And of course, WHO is looking at all these vaccine platforms and deciding which ones are most suitable, which ones can we use in the current crisis with Mpox.
How quickly has Mpox spread since the outbreak began at the start of last year?
It's very concerning. It's spread very quickly in areas where where individuals are at risk. DRC, we're seeing large numbers in DRC, and it's spreading to some of the surrounding countries. But what we're seeing is a very high health burden in those countries. Unsurprisingly, because of the way the virus has spread, we're starting to see it being spread to other countries too. There have been a few cases reported in Sweden and other countries too. I think Morocco reported some cases recently. And so it is very concerning. This is a particular virus which has quite a high health impact at the moment, especially in children. And we're seeing very large cases in a very short space of time. What scientists are trying to do is figure out what's changed about this particular variant, or clade as they call it, for Mpox.
Well, the WHO has been quick, though, to point out that this is not another COVID-19 situation. It's very different.
Absolutely. So this is a virus which is spread by close physical contact. And thankfully, we're not going to see as many people being infected from an index case as what we see with COVID. It makes it easier to control. And we're also not at a standing start like we were with COVID. We understand how this particular pox virus works, generally speaking, and we have a very good vaccine against it. So it is a different situation. And I think the WHO has been very wise in putting out this public health emergency now and rolling out the vaccines and getting more support for affected countries as it's doing. I think that's very, very wise indeed.
Dr. Cheryl Walter, really good to talk. Thank you.
My pleasure. Thanks for having me.